Hello and welcome. Thank you for spending some time with me today. And I'll be talking about our individual and family health plans we have available from Security Health Plan and through the health insurance marketplace. My name is Kay Kissinger. I've worked at Security Health Plan for over 20 years, specializing in the individual and family health plans. And I'm happy that we can talk about these plans today. If at any time you do have questions, please put some messages in the chat and we can make sure we get back to you. Let's begin by first discussing who we are. We are the sixth largest HMO in the state of Wisconsin, and along with our individual and family plans, we also offer Medicare plans, Medicaid plans, small and large group plans as well. So we can help you at any stage of life that you should need health care. Now we have two plans available based upon where you live. If you live in the blue counties on the map, that's our select plans. If you reside in the orange counties listed here on the map, then we have available a plan called Simply One. Now we first want to look at what the provider network is and who you can see for your care. We are an exclusive provider organization or an EPO. So what that means is you would need to make sure you're seeing our providers to receive your healthcare benefits. And of course, with both the Select and the Simply One plans, the Marshfield Clinic Health System is part of that network. And that includes 170 specialists, 10 hospitals, including the region's only children's hospital, and 57 clinic locations throughout the state. So you can go to any Marshfield Clinic Center and receive care with these plans. Also, you are covered worldwide for both emergencies or urgently needed services. So that gives you a little bit of information about the plans that we have in the provider network. Now let's take a look at the marketplace itself. The marketplace is called many different things. Sometimes I've heard it called the FFM, the FFE, the Affordable Care Plans, many different names for basically the same thing. It's what you can do to help yourself find health insurance. And you can do this online. You can either go to healthcare.gov, or if you're looking for Security Health Plan, you can also go onto our website, securityhealth.org, and we can assist you. Now, the marketplace plans were created by the government, again, to assist with people needing health insurance. Maybe you don't have coverage through an employer, or you're self-employed, or you're in between. That's what these plans are designed for. Now, there's certain rules regarding the financing of this plan, and we'll get into that in a little bit. But again, we can help you at Security Health Plan find the plan for you. Now, the plans are designated by metal tiers. That means the different amounts of coverage. So for example, if you're looking for the highest amount of coverage with the lowest out-of-pocket, you may look at a gold plan. And I'll go through the different metal tiers in just a moment. I've also been asked, do I have to enroll through the marketplace to get a health plan? And you do not. You can enroll through the marketplace to see if you qualify for a subsidy or a tax credit, which is a portion that would be paid on your behalf by the government based upon your income. But if you choose not to go through the marketplace, you can still select one of our plans as well. Now let's talk more about the metal tiers. As I mentioned, we have different metal tiers for different reasons. We'll start with the first one, bronze. The bronze plans are typically the lowest monthly premium plans, and they have a higher out-of-pocket. These can be used for someone who is healthy, doesn't go into the doctor very often, to keep the premium costs down. Now, the silver plans are a plan if you need a little bit more health care, or maybe you have a prescription or two that you know you want to be covered. Also with the silver plans, you could qualify for a cost share reduction. Again, this is going to be based upon your household size and income, and I'll talk about that more in just a minute. And then we have the gold plans. As I mentioned, this may be for someone who has a little bit higher utilization of healthcare, maybe a few prescriptions that they want to make sure that are covered, and a smaller out-of-pocket amount. The gold plan might be the right plan for you. Now we have a catastrophic plan. This plan is for people who are under the age of 30, and it covers all the regular preventive care, as do any of the other plans, at no copayment, but is going to have the highest deductible or out-of-pocket costs. And then we also have HSA eligible plans, and that stands for Health Savings Account. With these plans, because they're high deductible health plans, they qualify that you can open up an HSA through your financial institution. You can use those dollars that you put into the plan to pay for your deductibles, copays, and coinsurance. So we do have HSA compatible plans if you are looking for an HSA plan. Now, the ACA, or the Affordable Care Act, has expanded the benefits. And what that means is there's no longer a lifetime maximum or limit on how much can be paid for your medical expenses. But it also limits how much you pay out of pocket. For example, in 2021, the most that you could pay as an individual is $8,550. So that could be for deductible, copays, or coinsurance. Now, this does not include the monthly premium, but rather your out-of-pocket for medical expenses. Also, with these plans, coverage is guaranteed for everyone. So there's no medical underwriting, no health questions, and no pre-existing conditions. Now, as I mentioned earlier, the rates or the premiums are set by a few factors: the age of the people in your household you'd like to be covered, where you live, what county, also the family size, how many people, if anyone in the family uses tobacco. Also, to find out if you will qualify for a tax credit, we would want to know what your modified adjusted gross income is for the household. So those are the ways that the rates are determined. Now, with any of the ACA plans, we do have essential benefits included in these plans. And the essential benefits are listed here. That's going to be your outpatient care, ambulatory, emergency and hospitalization, maternity and newborn care, mental health and substance abuse order services, prescription drugs, rehabilitative and habilitated services and devices, your labs and blood draws, your preventive and wellness services and chronic disease management, and of course, pediatric services include oral and vision services. So those are the essential health benefits that are covered on all ACA plans or marketplace plans. Now, also included in marketplace plans are our preventive care services. You'll see some of them listed here. Now, these services, as long as they're done with a network provider, are covered at no copay, no deductible, and no coinsurance, even if you haven't met your deductible yet. Some of them are listed here: diet counseling, immunizations, blood pressure screening, cholesterol and colorectal cancer screenings, type 2 diabetic screening, hepatitis C and HIV screening, lung cancer screening, and screening for sexually transmitted diseases. These are all considered preventive care services, again, that are covered on all of the plans at no out-of-pocket for you, as long as you stay within network. Now let's talk about the subsidies and tax credits. So the cost sharing reduction or subsidy reduces your out-of-pocket costs if you take a silver plan. If you remember, we talked about the different metal tiers, so make sure that it's a silver plan. So again, dependent upon your income, you could get a reduction in your deductible. So rather than paying, let's say, a $6,000 deductible, it could possibly reduce to a $4,000 deductible or even less, again, dependent on income. The next portion here is the advanced premium tax credit, or tax credits as people call them. What this means is that you could have a portion of your monthly premium paid for by the government. Again, this is based upon the modified adjusted gross income of your household. Now, if for some reason you choose not to take the tax credit, but you do qualify, then you will receive that amount back on your taxes at the end of the year. Now let's talk about the newest act, the American Rescue Plan Act. With this plan for 2021 and 2022, there have been some changes to the guidelines. What this basically comes down to is it's expanded the amount of tax credit a person can receive. It's also expanded the dollar amount. So in the past, if an individual, let's say, made $65,000. They would not qualify for a tax credit. Now with this expansion, the new act, a person would qualify for some tax credit. So again, it's the government helping to pay towards the premium. Okay. And the subsidies or the tax credits are retroactive back to January 1. So even if you said, oh, I didn't know about this, I wish I would have known, they will be retroactive back to the first of the year. But I want to stress this, please go into your marketplace application and update the information. Or if everything has stayed the same, there will be a question that says, do you want to find out if you qualify for more tax credit? Of course, you're going to want to say yes. So please take the time to go ahead in your application if you're already on the marketplace and renew it. If you're not, when you first go onto the marketplace, of course, that means that you can look for a plan. And of course, we have until August 15th now. If you would like to have a marketplace plan, that's another part of this Rescue Plan Act, is that it increased the time that you can enroll. So again, you have until August 15th to take advantage of these new tax credits. This is a little overview of what the current requirement is and what the new American Rescue Plan Act is contributing regarding how much you make of the federal poverty level. So you can see the percentage there. And again, it boils down to you're getting more chance to get tax credit, regardless of what your income is. Now, there is still a threshold or a cutoff, but it's a lot less than what it was before. So now you could possibly have a higher income and still qualify for a tax credit. Here are some examples. The first is an uninsured 55-year-old couple, non-smokers. Their income is about $70,000 and they live in Clark County. Now, prior to the American Rescue Plan Act, they would pay the whole amount, the $2,234 for that second lowest cost plan in their county. But now, under the new act, they would receive a tax credit of $1,739 per month, which would then make their monthly premium only $496 for that same plan. So again, this is an example of how it's been extended. The next example is a 40-year-old person who's currently on a plan, but not on the marketplace. So they purchased it off exchange or off the marketplace. Again, non-smoker, $52,000 is the annual income, and they live in Eau Claire County. Prior to the new act, they would have paid $636 for that silver premium plan. Under the new act, they would receive $268 in tax credit, which was reducing the monthly premium to $368. So again, it's time to get out there and look at plans. You have until August 15th. And the last example is a 6-year-old couple who's already on the marketplace. Their income is $19,000 and they reside up north in Oneida County. Prior to the act, they would have paid $949 premium, okay, for that same plan. But now under the new act, they received, based upon their income, $949. So that means their premium is $0 for the exact same plan. So again, please make sure you go out and check it now with the new plan. It makes things a lot greater as far as your tax credit and options. So again, the ways that you can find out is to go to healthcare.gov to update your application, or if you're new to a plan, to enroll into a plan or start your application. If you're currently enrolled on a plan outside of the marketplace or you don't have coverage, again, give us a call, okay? Or you can go online to securityhealth.org/IFP plans. Our phone number is 844-221-9345. When you apply, make sure you have this information. Of course, you're going to need to know your social security number or a document number for any legal immigrants who need coverage. If you do have any type of employer income for you and anyone in your family, because you do want to determine what your total out-of-pocket will be and your premiums, and that is based upon your modified adjusted gross income. And then if you have any information regarding a job-related insurance policy to make sure that you would qualify for a marketplace plan. And lastly is an email address, because of course this is online and that is how they will get the information to you. And another way that you can go in and update your account. So after today, if you need assistance, please feel free to give us a call. Again, our number is 844-221-9345, or you can go online to securityhealth.org. I want to thank you for joining me today. Please, again, if you have any questions, give us a call or hop online and we'd be happy to help you. Thank you.